So what about ozone's uses in dentistry? This is what got me really excited about ozone 7 years ago when I saw Dr. Lynch's presentation in Barcelona. It destroys 99% of all cariogenic microorganisms. Because of small molecular size, it can penetrate up to 5 millimeters. Again, as he mentioned, we have to be on the safe side. 1 millimeter, we know for sure it will be very active within the 1 millimeter range. But it possibly can go to 5 millimeters. Tooth whitening by destruction of the chromatic chemical rings, root canal sterilization, gingivitis and periodontal inactivation of volatile sulfur compounds, which are the main cause of halitosis. So we do end up having a lot of sweet breaths and sweet-smelling patients, and of course surface decontamination, and cold sterilization of dental materials. So how do we use the ozone therapy? We kill the bacteria in and around the teeth and in biofilm. It alters the aciduric environment. This is something that's really important. We know, all of us, that when we acid etch a tooth, a perfectly good tooth, within a few hours, that acid etch reaction is gone because the calcium, the phosphate in the saliva will remineralize the teeth if it's in a healthy form, if it's in a healthy individual without any caries. But in a patient that has caries, this doesn't happen because there is an aciduric environment. There is a cycle that you have to stop. When you get rid of that acid-forming bacteria situation, you will have the body kickstart. It actually kickstarts the body to creating a good remineralized surface. So it permits the natural remineralization from saliva. You're kickstarting this remineralization by helping the body. We want to proactively intervene. This is proactive intervention. We are intervening in the caries process. We're stopping that formation of acid by the bacteria, and we kickstart the remineralization. It's very well researched in the labs, in vitro, and we know in most cases there's no anesthesia needed. And most importantly, it's clinically proven. Since 2003, when I saw that presentation, I've been using ozone in my practice, and I will use ozone on every single tooth that has to be restored. So to summarize, saliva is naturally supersaturated with calcium and phosphate. It wants to remineralize the caries, but unless we remove the caries-producing bacteria, this won't happen. The regular production of caries counteracts this healing process. So as soon as we remove that, we are able to heal caries. So Ozone, as many people have spoken about, was the pioneer. That was the first system that actually worked well clinically. Medical device, has a vacuum pump, ozone neutralizing filter, and a handpiece with sealing caps. The important thing is you couldn't get a seal on gingival tissue very easily. That's why it's not really something that's indicated for gingival issues. The ozonics is. You can use the ozonics machine very easily on gingival tissue. But for caries and for hard tissue, Ozone is good if you can get the parts, which, as Dr. Friedman mentioned, has become very difficult, especially in Canada. I don't know what it's like in Europe, but in Canada it's almost impossible to get parts for this machine. You can't get the cups. So you're dealing with a very large cup when you need a small cup. And then for sure you're not going to get a seal. The difficult thing of getting a seal is it's something that needs a learning curve. Over a long period of time, you need a learning curve to learn how to produce a proper seal. In terms of clinical situations, with open decay, what you do is you remove the soft material, and then you can deal with the ozone to remineralize and not even necessarily fill the tooth. If the patient is happier without it being filled and it's not in an aesthetic area, it can be better to just leave it as it is as long as it's ozonated and there's no longer caries. In terms of seal decay, we have other ways of dealing with it. Over here you can see in the second picture, this is a hard area. There are some areas of demineralization and areas of caries. So you would scoop out the soft areas and then ozonate. I was shocked when I first saw Dr. Lynch's presentation. He said, this will actually remineralize. And it did. Patient after patient, after you use the ozone on areas which have about 1 millimeter of soft area or more of a leathery type of substance, it becomes rock hard. It's not leathery anymore. You can't scoop it out anymore. You take out the soft, mushy material, but the leathery material you do not have to remove. It'll remineralize and become just like any other dentin. And actually, as he mentioned, it becomes more resistant to decay. So it's actually a stronger material. So in this case, you would remove that soft material, then you would remineralize, you would hit it with the ozone, and in some situations, in this one I would fill it with a composite material, but in some cases I would just leave it. In the top area, I might leave it, depending if it's an fraction lesion, I might leave it because it'll probably pop out anyways. So you ozonate it, and you can use any kind of remineralizing material. You can use MI paste, and you can use things like Novamin, which is an American product, which was just bought up by GlaxoSmithKline. You can also clean it out and use silk as a bioactive glass. Novamin is a bioactive glass that is in silk, and you should look up the company called Silk, SYLC. They have this bioactive glass, which is wonderful for remineralization. So you clean out the area, you get rid of the bacteria, and then you remineralize with a material like bioactive glass.